Today, I wanted to highlight something I saw and talk a little bit about it. What I saw was that Senator Andy Kim of New Jersey was proposing a Medicaid expansion so that all children are covered by Medicaid.
I want to talk about Medicaid expansion for children and just Medicaid expansion in general. And if you aren't already following Jamel, I highly encourage you to do so. But essentially, he's talking about Andy Kim and Senator Alex Padilla of California's joint plan to expand Medicaid coverage to individuals between 0 and 26 years old. So essentially, all individuals under the age of 26, regardless of income, would be able to receive free healthcare coverage. And this is not actually the first time we have expanded Medicaid. The Affordable Care Act, also known as Obamacare, right?
They're the same picture.
Expanded Medicaid starting in 2014 to individuals who earned up to 138% of the federal poverty line. And as of today, in 2026, 41 states, as well as the District of Columbia, have chosen to expand Medicaid. And the reason that some states have chosen to expand Medicaid and others haven't has to do with the fact that states can choose to opt into this plan. Originally, all states were going to have Medicaid expanded, but the Supreme Court said you can't do that. And so now, in order to understand the economic and health impact of expanding Medicaid for all children, we can look to Medicaid expansion that happened in 2014 and see the impacts there and draw some logical conclusions. So we know from economic studies that Medicaid expansion significantly decreased the uninsurance rate, right? The amount of people who don't have health insurance in participating states by about 6.4%. And these gains specifically affected people of color more strongly. So Black and Hispanic enrollees experienced the biggest drop in uninsurance. And because of this increase in insurance coverage, a lot of individuals were able to gain access to medical services, which actually resulted in a decline in mortality for those individuals who were enrolled in Medicaid expansion compared to those similar individuals in non-expansion states. We also know from economic studies that physical health and financial health are closely tied together. And this means that when we look at the impact of Medicaid expansion on things like debt and credit scores, those metrics for individuals on Medicaid expansion significantly improved, right? People who were on Medicaid had lower debt and an increase in their credit scores. We also know that health insurance coverage for children in general is a big deal. It significantly improves their long-term outcomes, not just in healthcare related things, right? Of course, we know that it increases preventative care use and improves their long-term health, but also it lowers high school dropout rates, it increases wages, which of course results in higher contributions to federal taxes, it results in higher educational attainment. The impact of providing health insurance coverage specifically to children is such a significant investment, which is so interesting, right? Knowing what all of the economic and public health research tells us about how Medicaid expansion and insurance coverage expansion in general impacts children, how all of that relates when we compare it to the cuts to Medicaid that were passed in the One Big Beautiful Bill, which is estimated to put nearly 1 in 5 children at risk in losing their health insurance coverage. Now, while nearly half of all children are currently covered under Medicaid, essentially a lot of the laws and the provisions of the One Big Beautiful Bill places those children from requiring the federal government and states to cover them from a mandatory category into an optional category, about 18%. And if there are cuts to Medicaid that make it so states can't cover anyone, those children in particular are vulnerable of losing their Medicaid coverage. Now, if you've been following me for a while on this page, you know I've been saying for years that the most likely way we will achieve universal coverage for healthcare in this country is not by tearing the system down and rebuilding it from the ground up. It's essentially using the systems that we already have, right? Medicare and Medicaid to expand coverage out for greater and greater groups. I know it's way more attractive to want to say we need to tear it all down, but we have the bones in place and we've seen the economic and health benefit of expanding the systems we currently have. And you could do something very similar with Medicare, which is the health insurance program for people over the age of 65. In fact, almost 10 years ago, which I can't believe I'm saying that, there was an effort and a bill that was put forth to allow people who were are between the ages of 55 and 65 to buy into Medicare. Now, a couple things here. Personally, in order to fully evaluate a program like this, I would want to see a cost-benefit breakdown similar to something that the CBO does of Senators Kim and Padilla's plan. Because I know I'm going to get comments that say, well, I don't want the government increasing my taxes. And I totally hear what you are saying. However, if you think about the trade-off, right, between taxes and what you are currently paying with premiums, deductibles, copays, and coinsurance, along with all the added administrative costs that a lot of private health insurance companies tack on to healthcare costs, right? It's not that clear of whether or not this is a positive or negative trade-off for individuals, which is why you would have to run an analysis like that. The second thing is I want to acknowledge that based on this administration's current views of Medicare and Medicaid and the cuts that they make, I don't think that this is a provision or a stance that will happen anytime soon. However, knowing what we know about Medicaid expansion and knowing what we know about increasing insurance for children, to me, this is the most likely way. If we have the energy and the appetite for it, this is the most likely way we can achieve healthcare for everyone. And for now, that's all I got. As always, if you have any questions, let me know.